Seniors advocates in British Columbia are pressing the government to make good use of more than $700 million in new funding that has come from Ottawa. The provincial and federal health ministers signed a deal yesterday. Marianne on the story for us with the details of the deal itself and what the money's intended to do.
Hi, good morning, Heather, because we know that the population in British Columbia, it's of course aging, but they're also living longer. So they're seeing a rise in seniors living in British Columbia. So this funding announcement from the federal government yesterday, $733 million over the next 5 years to improve senior health care. That's definitely welcome news for advocates and families. They just want to make sure that this money is spent properly and being put in the right places. I'll have more reaction in just a few moments. But what we know about this money from the federal government is that it will help expand care, also expand care when it comes to long-term care, increase access to palliative care, and even end-of-life care outside of the hospital. According to health officials and the federal government, this is all about maintaining dignity for aging seniors who require this much-needed care. This is actually the second major health funding announcement from the federal government in British Columbia. Just 4 months ago, it announced $1.2 billion to improve the way health records and sensitive health information is collected. But this here, these images that we're looking at right now, something many families are familiar with if they have aging family members, and so this money and how it will be spent will be watched by many families who are interested to see if it's going towards those right places in care.
Well, as you say, what are the right places? I'm wondering what would be the proper use of these funds according to seniors and seniors advocates.
Well, it really does depend on who you ask. On the one hand, there are advocates saying that British Columbia is one of the only provinces in the country that still charges for at-home care. They want to do away with that copay to make this much more affordable. Yes, there is the guaranteed income supplement for seniors. If they have that, they don't have to pay for at-home care, but that only represents 30% of the population of seniors in British Columbia. So here's more from one advocate who wants to see that money go towards that.
If a person, a single senior living at home alone, had an income of $29,000 a year, and we were going to give them 1 hour of home support a day, which is not a lot, we're going to charge that person $9,000 a year. So this cost prohibitive issue is real.
It's also a reality for many families who can't pay for that at-home care because it is just so expensive depending on what your family situation is. And there are fears that that is actually pushing some seniors who need care into long-term care homes even earlier. And we spoke with one person whose mother is in long-term care, and he says he's skeptical that residents like his mom will see that money.
I don't know how far $700 million goes. I mean, anything that's going to help improve the life for our residents is always welcomed. I hope it just doesn't get, dissolved into the general operating budgets of the different health authorities and things like that.
And so $733 million over the next 5 years. That's a good amount of time, a good amount of money, but a lot of questions and concerns, Heather, as we hear about whether those who need the care right now will actually see it.
Thank you very much, Marianne.